Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. According to the National Autism Association, 1 in 31 children in the U.S. have Autism Spectrum Disorder, which is why April is National Autism Acceptance Month. Not awareness, but acceptance. Many in the autism community have shifted toward acceptance to signify a move from merely knowing about autism to taking action to create a welcoming society for those with autism. So today we're talking with Dr. David Huss, pediatric neurologist at WVU Medicine Golisano Children's Neurodevelopmental Center, to talk about autism and how to move from awareness to acceptance. Welcome, Dr. Huss, to Live Healthy West Virginia.
Well, I'm really happy to be here.
Well, it's good to have you here. So before we move on to autism acceptance, let's talk a little bit more about just a little reminder about autism awareness. It's called Autism Spectrum Disorder, but what exactly is the spectrum?
Yeah, so traditionally the spectrum came about when they merged some conditions that had a lot of overlapping traits together. So there used to be a diagnosis called Asperger's, and that got kind of folded in to autism. That's partially why the rates went up significantly, because we took two conditions, combined them together into one. But with that, there's the acknowledgement that people have a wide variety of symptoms and challenges that they have to deal with autism. So, and increasingly, traditionally we have kind of three levels of autism: level 1, level 2, level 3. People are always, really concerned about where do they fall, or where does their child fall on that spectrum?
Yeah.
Well, one of the things is actually they are defined as levels of support. So actually, it's not a permanent thing. You can be at one point in your life maybe more level 2, need a little bit more support, but maybe you develop some better skills that you can use yourself, and maybe you're more of a level 1. For a while, and then maybe something happens in your life and you suddenly need more support again. Maybe you go away to college, and then maybe it's more of a level 2. So they aren't permanent levels even. So it's an acknowledgement that there's, it's kind of this fluid spectrum of conditions.
So you can actually move on the spectrum.
Yeah, you actually can with the things. And increasingly, people acknowledge that it's maybe not even right to lump everyone level 2, level 1, level 2, level 3, that there's, some people. And sometimes people even will say they'll divide it in half. So they'll do a level for your social communication deficit, and they'll do another level for restrictive repetitive behaviors. I'll see people even put that in their medical notes. Other people will say, oh, there's even more to that. It's like this, you'll come up with these kind of weird graphs with all these things going each direction. So it is like just acknowledgement that everyone's symptoms are different.
Yeah, it's a very personal condition, isn't it?
Yeah.
Yeah.
So.
Wow. So, you said there's a lot of different things going on here. Can you give us an idea of what it's like to live with autism through the eyes of a child that has autism? What type of challenges are they facing?
Well, and again, if you met one child with autism, you met one child with autism. So everyone has different challenges.
Yeah.
You have some kids that, and with it being a spectrum, you have some kids that they do not communicate verbally, and that's very different than you have some other children that are even hyperlexic.
Now, what's that mean, to be hyperlexic?
By hyperlexic means they have a lot of language. So they'll use bigger words at a younger age. They'll be able to read at a very young age. And things like that. So it's a huge spectrum. So it's every kid will have a different experience and different challenges. So.
Okay. So I imagine that makes it challenging to support.
It does. Well. Yes. Yeah.
Yeah. So, What are the early signs parents should be looking for if they suspect, well, maybe my child is on the spectrum?
Yeah. So, I mean, one of them is not responding to your name is a big one. So a lot of kids with autism at a young age, once you're about 1 to 1.5, you probably should consistently, if someone calls your name, turn and look.
Yeah.
That's an early sign. Another is actually this concept of shared attention. So like kids with a lot of times individuals with autism, they aren't as good at telling, pointing at things, sharing it with them, and actually having this eye contact that's coordinated with the point. That can be something that kind of clues you into it. And then, of course, language deficits. So if you're not really speaking on time, it's not always autism, but, that should be one of the things you consider.
You look at. Yeah, sure. Why have autism rates been on the rise over the last 3 decades? I know you touched on a little bit of that with the changing.
I touched on a little bit. There's probably several factors. So one is, again, we have literally changed the definition of autism over the years.
How so?
Get a little medical. So we define autism is actually defined in what we call the DSM, the Diagnostic Statistical Manual. Sorry, little tongue twister there. And every year they've actually changed the definition.
Really?
Yeah. So I mean, every edition, not every year, every edition.
Yeah.
So we're on the DSM-5 now. That's the one that has the spectrum where they folded everything together. We go back to the DSM-4. There were separate diagnoses of Asperger's and autism, and there was also a few other diagnoses. They all folded into autism.
Okay.
And then you go back even further, and the definition of autism actually was really hard to meet. If you go back, it was some of the original definitions, they actually used the term bizarre. You had to have truly bizarre behavior.
Oh,
that was in the definition to have
in the DSM.
In the DSM, you had to have bizarre behavior, which is a very strong word. So not that many people met that criteria back then, in the older editions. So they've loosened the language a little bit to make it, again, you don't have to be bizarre to have autism anymore.
Oh my gosh.
It was just what it used to be. I mean, and then we also are just more aware, where we have more awareness, especially in women. Women were underdiagnosed for years. They still are. There still is some evidence that, racial minorities are still underdiagnosed. And we've been getting better at that. So as we do that, the numbers go up, plus we change the definition.
Sure.
And which is great that we are identifying people. Of course, the downside of that is that people see these huge increase in numbers and they think it's chemicals in our food. They think it's, mercury in vaccines. They think it's all this other stuff causing it. And it really, if you look at it, it correlates exactly with how we've changed the definitions and how we've gotten better at diagnosis.
That actually makes a lot of sense,
Yeah.
When you put it that way. I don't think a lot of people realize that, But do we know what causes autism?
It's probably mostly genetic. We know that we know, one of the things actually we were really good here at WVU about is actually doing genetic testing. So I know I'm in the neurology department, but I do want to give a shout out to my friends over in genetics. They do an excellent job. They get people in fast. But as we've been testing more, we keep finding more and more conditions that are associated with autism. And there's over 200 genes now, a bunch of chromosomal deletions and duplications. Now, the sort of autism you're going to find these genetic mutations with are the ones that also have intellectual issues and some other issues with them, kind of what we call more syndromic autism, rather than the autism that's kind of in the media. I always joke, I always kind of say like the autism like Sheldon from Big Bang Theory or something.
Yes.
That sort of media autism with the super smart nerd type person, you're probably not going to find a genetic. If you send off genetics, it's probably going to be negative.
Okay.
It probably still is genetic. It probably is just multiple genes interacting together.
Okay.
Because when we send off genetic testing, if it's not just one gene causing the condition, if it's multiple genes kind of ganging up together or interacting, we can't really detect that. We can only really detect one gene. That's kind of where we are with genetics right now.
And we're pretty advanced.
We're pretty advanced. But that's just kind of where genetics is right now with that. But it probably is, genetic. And we do know that at least a large amount of it is. And we do know that if you have like an intellectual disability with autism, if we were to send off genetic testing, we get about a 30 to 40% chance of finding something.
Wow.
So,
wow. Well, there's obviously room for advancement there.
Yeah.
All right. You kind of hinted at a few of those myths, but let's do a little myth busting
Sure.
here. Don't you think there are? I mean, is it just me? But there seems to be a lot of myths surrounding autism.
Oh, yeah. And again, it's people trying to make sense of it. And,
Yeah.
it's, and I can't blame them. I mean, we really
Sure.
have changed the definitions. We really have gotten better at making the diagnosis. So, of course, you look for something that could
Sure.
be doing that. And people have come up with vaccines, and there's really no evidence for the vaccines at all causing autism.
So that's the first one.
That's the big one.
Let's get that one
That's
out
the
there,
big
right? Yeah. Vaccines. Well, while we're on vaccines, does Tylenol cause autism?
No, I mean, there were some initial studies that maybe showed possibly a correlation, but even those studies weren't all that well done. They were things like, one of them, they just measured mothers' Tylenol levels at birth. So it wasn't even like a retrospective, like how much Tylenol did you take during your pregnancy? It was mother's blood that they collected while they were in the hospital giving birth, and they just somehow correlated that with autism rates. And we do know that there are some things that can make autism more likely. Actually, just having an illness during your pregnancy can actually increase rates of autism. So
really?
So
like what kinds of illnesses?
Like the flu.
Oh, okay.
Like something as small as that does slightly increase it. So the question always was it really picking up on the Tylenol, or was it the reason you were taking the Tylenol?
Oh, that's a really good point. Because
there's always this correlation and causation. But when they've actually done these larger studies, and one of the biggest ones was done in Europe, where they had a whole bunch of data, like cohort data, they don't find, there's no correlation of Tylenol and autism. So anyone that's taken Tylenol during their pregnancy, you don't have to feel guilty. It's
I took it through all three of mine. So vaccines, Tylenol and Tylenol don't cause autism. Sure. Can you catch autism?
No, as we just said, it's probably mostly genetic, with some other factors maybe influencing it a little bit, but no, it's not something you can catch. So,
can autism be cured or prevented?
No, but you can help people live better lives, and like I said, your levels can change. You can through therapy, through support. Someone who needs a lot of support and is not doing as well as what we call kind of a level 2 or level 3. Mm-hmm. That person could be a level 1 in the future. So no, we haven't cured their autism, but we have made them better able to live in society. Have more happier, more fulfilling lives. So.
Yeah. Well, that makes sense. This one makes me sad. Autism is caused by bad parenting. That's a myth.
That was one that was, in the kind of the 50s, way back, long time ago. The kind of cold mother, and that's been thoroughly disproven. Mm-hmm. Also, again, with it being genetic, maybe some of that came about because mothers who have autism are more likely to have kids who have autism, and they have some social differences, and maybe people kind of blame that. So.
Yeah, that kind of makes sense too. And finally, autistic people are savants or geniuses, or vice versa.
Well, I kind of hinted at that with the media's, Big Bang Theory,
with
kind
Sheldon.
of nerd. Yeah, Sheldon things. I've actually never watched that show, but I know it from.
But you know what they're talking about.
I know what they're talking about.
Yeah.
No, I mean, that's not really the truth. If you actually look at kind of autism, it's about a third actually have, again, intellectual disability. And those are the ones that I was saying you're more likely to find a genetic cause for. And so, no, the whole range of intellect is possible with autism. And there's not really this savant abilities, although you do have sometimes. I mean, one of the core features of autism is restrictive and, interests. So you do have people that do develop kind of some really good skills because they have an interest they're really interested
into something.
They're really into whatever their hobby is, and they get really good at it because that's what they spend all their time doing, or that's what they really want to do. So there's maybe a smidgen of truth to that, but no, it's not how it's portrayed in the media.
Okay. So we should take that with a grain of salt, right? When we see that.
Exactly.
Let's talk about treatments. First of all, early intervention makes a huge difference, doesn't it?
Oh, we know that getting in as early as possible is super important. We do try to, even here at WVU, we prioritize our younger patients to get them in quickly. We have even early access to therapy just for the younger children to get them in. So, yeah, it makes getting therapy as soon as you can to kind of build those skills, because they snowball. You get some of those social skills, and then it helps you learn as you grow older.
Is it ever too late?
No, it's never too late to get evaluated and get help and to get assistance, or to better understand yourself, or so it's never too late. So
okay, well, that's good to know.
Yeah.
One of the treatments is ABA therapy. You had mentioned earlier. What is ABA therapy?
So it's called applied behavioral analysis.
Okay.
And we can just kind of break down the words.
Yeah, let's do it.
Behavioral analysis that you apply to someone. So behavioral analysis is kind of, again, I'm not an ABA. I'm sure the ABAs out there are going to be like, Dr. Huss has it all wrong. But they're going to be mortified at me. But what they do is they study a behavior, and they kind of figure out how to reinforce that behavior to get it to happen more. Or if it's behavior you don't want, how do you get it to happen less?
Okay, so how do you do that? How does that work?
It can be any. ABA, it could just be, you could, for example.
Give me an example of a behavior.
Well, I don't know. You could even just do it with, it doesn't even have to be a person with autism. It could be, you could just encouraging someone. That could almost be ABA. Like if
positive reinforcement.
Positive reinforcement. Like going up to someone and say, "Oh, I really like the job you did today when you did that."
Yeah.
So that kind of is. And now ABA, they do it much more analytical. They have graphs and charts, and they see how it is. But it really is just positive reinforcement, trying to figure out what that positive reinforcement is. And some kids with autism, it could be, well, one of the things the kids at our center they like wagon rides. So you'll see a lot of kids at the Neurodevelopmental Center, they'll be wheeled around in their wagon while they get to maybe watch a YouTube video or something, and that's their reinforcement kind of for doing a behavior that they might like, or things like that, so it's figuring out how to reinforce behaviors we want to see and encouraging them. So
that makes sense. What other therapies are utilized in supporting? I don't know. Is treating autism the right word?
I think
more support is better,
or just helping to maximize potential.
Yeah. How else do you?
The two big therapies would be speech and occupational therapy. So as we know, a lot of individuals with autism do have delayed language, so speech makes perfect sense.
Sure.
But speech therapists don't just do that. They also frequently work with feeding. Because, picky eating is pretty common among individuals with autism. Okay. And there's, sometimes it's the speech therapists that do that kind of thing. Sometimes it's the occupational therapists. They'll do feeding therapy too. But then occupational therapists, they're important they can work on sensory differences, like having to accommodate, different sensations, lighting, sound, things like that. Occupational therapists can work with that. They also can work on learning to do activities of daily living, like helping to brush your teeth, things along those times. And sometimes, especially with the sensory issues, some kids don't like to brush their teeth with the sensations of that. So.
Okay. Are there any therapies to beware of?
Oh, there are
wary about.
Yeah, there are plenty out there.
Really?
Well, everyone's looking for a way to cure autism, as we just said.
Yeah.
You can support autism. You can make symptoms lessen. You can even go down in levels. Can't really cure it. But there's all sorts of supplements out there. I always say if your doctor is selling the supplement, that's a bad sign.
That sounds like a big red flag.
That's a big red flag. I'm not anti-supplements. Anyone comes in my clinic, especially with headaches or sleep problems, I frequently recommend things like magnesium.
Sure.
But I don't sell it to you.
No.
I'll go on. I'll go on Amazon and help you, or wherever, help you find the cheapest way to get it.
Yeah.
And I'm not the one selling it to you. So there's a lot of people that sell supplements of all sorts out
sad.
there. It is, and they can be pretty expensive. And then there's some therapies that can be outright harmful. People have done things, even again blaming mercury. They've done things like chelation therapy, where you
What's that?
So when you actually have heavy metal poisoning, we can give essentially drugs that bind to the heavy metals and help your body excrete them.
Oh, okay.
And you have to give them through an IV. And they're not always without risk, because again, an IV is an IV, but there also can be allergic reactions to the medicine, things like that. But people will do chelation therapy for autism, where they try to remove heavy metals that really aren't there, but people will, sell things like that for it. There's all sorts of, therapies. One that was recently in the news that was promoted a few months ago, back in October, was a drug called leucovorin. There was these studies about leucovorin curing autism. Some of the studies were pretty flawed. In fact, one of them I actually read myself, and I helped with another physician report it, but the study actually had math errors in it. There were actually these two tables, and when you looked at them, table 3 didn't line up with table 2, and you're like, well, these two things can't be true. That was actually reported. They actually pulled that paper and actually got taken off. So there's actually no evidence for leucovorin. That was a popular one just a few months ago, actually.
Wow.
So
it's a shame people take advantage of people.
I don't know if I want to give the authors of that paper the benefit of a doubt that they were maybe just really bad at math. I don't know. But
I am.
Yeah, well, I don't know. But that paper got pulled, and the Pediatric Neurology Society, or the Child Neurology Society, they put out an official statement kind of against leucovorin.
Okay.
And, so a lot of the other major.
So we'll stay away from that.
We'll stay away from that.
Okay. Can you tell us what a parent can expect at an autism evaluation? Yeah,
so, autism evaluations do take quite a bit of time. They're longer than a normal doctor's visit. Ours is actually multifaceted. How we do it, we actually have a whole interview that happens even before you come to our office.
Wow.
We have someone call, we do it over the phone, get all the information. So we take that down, make sure we're the right clinic, and, and get some, we give them some, because it does take a while to come in and see us. We give them some support in the interim period, because they get that kind of initial interview rather quickly. And it can take a while to see someone like myself or some of the nurse practitioners that work with me. But our autism, appointments, they all are at least 90 minutes long, and they usually involve kind of watching the kid play. We usually do some sort of developmental screening or intelligence test, and we will do some sort of autism rating scale, or sometimes even a more involved test. There's this thing called the ADOS we'll sometimes do, where we watch the kids play certain scenarios, and kind of from that we can make we can help make the diagnosis.
Okay.
So.
All right. So, I guess if we can talk a little bit about moving on to acceptance.
Sure.
We already talked about the difference between acceptance and awareness.
Yes.
Yeah. So what are some things we all should be doing to be more accepting?
Well, I think just, being understanding, when you see someone having like what people might call a meltdown, or having, some issues. I'm just kind of understanding and letting them process what they need to process. I mean, I'm of the opinion everyone has different needs. It's all different. One person with autism is one person with autism. So it's just doing what's reasonable to do to help someone out. So
not being so judgmental.
Yeah, exactly. So,
okay. Let's talk a little bit about the expert team at WVU Medicine Golisano Children's Neurodevelopmental Center. There, I got it all together.
I mean, we're pretty unique in that, there's not too many clinics like us, and we're one of the few in the region where we're all integrated. So you have physician. Well, currently I'm the only physician out there, but I have someone will be joining me in about a year.
Okay.
But we also have 2 wonderful nurse practitioners out there too.
Okay.
So and we have a psychologist, and that's kind of the more medical side. We're the ones kind of making the diagnoses, doing that sort of thing. But then we also have this great team. We have ABA out there, and we're one of the ABA is a really scarce resource, so we're really fortunate to have them. And again, we kind of talked about what ABA is, but we kind of have 2 different ABA programs. We have one that's kind of intensive therapy, where the kids will come in several days a week, and they work with an ABA technician, and they're there almost like school.
Oh, okay.
It's very intensive. We can't serve too many of those patients at a time because requires one-on-one involvement. So that there is a significant wait list for it. It does take a while to get into that therapy. We have another, because we do know that early intervention is really important. We call the Early Learners Program. And those are like kids who are more 2 to 3, kind of that age group. And that focuses more on, because if you think about it, who do patients spend the most of the time with?
Their parents.
Their parents.
Yeah.
So what we do with that one, we try to give the skills to the parents.
Oh.
So they can't become full ABA therapists, but they can kind of pick up some of it themselves. They're with the kids more than anyone else.
Exactly.
So if we can get them having some skills and working with their kids, it works really well.
Oh,
and that
neat.
one because it's not as, it's not one kid with one ABA technician for hours. We can serve a lot more children that way. So that's how we're kind of getting that really rapid early intervention happening. So,
wow, that's exciting. That's good stuff.
Yeah. And then I can't
go ahead.
Well, I don't want to leave off. We have great physical therapists out there, speech therapists, and occupational therapists.
And that's all part of supporting autism.
It's all supported. It's all in one building. I mean, they don't have to go. It's all right there.
It's all under one roof. And this is in Morgantown,
Morgantown.
Bakers Ridge Road.
Yeah, right across for people that do live in Morgantown, right across from University High School.
So, yeah. Yep. I'm familiar with that. So thank you again for sharing all this information. And we'd love to have you back again another time.
Yeah, sounds good.
We can talk about this another time. Okay. So that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about care for kids, visit WVUkids.com. To find the latest episode of Live Healthy West Virginia, follow us on our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist, or follow WVU Medicine on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Huss and everyone at WVU Medicine, thanks for joining us.